Dr. Njoo.
Thank you very much, and merci, Eric. Hello, everyone, and thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Major General Danny Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada. We will provide brief remarks and then open the floor to questions. To assist us in addressing your questions, we have with us Joël Paquette from Public Services and Procurement Canada. To date, more than 7 million doses of COVID-19 vaccines have been administered in Canada. Among those people 80 years of age or over, 81% have received their first dose and 10% have received their second. And among those 70 to 79 years of age, 53% have received their first dose and 2% have received their second. Yesterday, the National Advisory Committee on Immunization, or NACI, outlined evidence that reinforces their recommendation to extend the time between the first and second dose up to 4 months. Once all eligible populations have been offered their first doses, second doses should then be offered as soon as possible. The rationale for NACI's latest update is that extending vaccine dose intervals will optimize vaccine rollout and allow many more people to gain protection by receiving their first dose of an effective COVID-19 vaccine sooner. Although the vast majority of people in this country were unaware of NACI until only a few months ago, the committee has a long history of providing trusted advice in Canada for more than 50 years. Members of the committee are experts in infectious disease, medicine, public health, epidemiology, immunology, anthropology, and health economics who provide advice on vaccines to ensure the best guidance for the Canadian population. It is important to point out that these experts volunteer their time and expertise to be part of this advisory committee. NACI and Health Canada perform important yet distinct roles. As the regulator, Health Canada authorizes vaccines based on evidence obtained from clinical trials and post-market surveillance. It does not make recommendations on how the vaccine should be used for the best possible public health impact. While NACI reviews the same clinical trial data as Health Canada, it also carefully considers all available evidence about how well the COVID-19 vaccines are working in the real world and applies a public health perspective considering the burden of illness in Canada. Beyond the vaccine characteristics, NACI also reviews mathematical modeling, assesses vaccine supply, and takes into account the programmatic realities of equity, feasibility, and acceptability. NACI is focused on the public health perspective to promote the best outcomes for the greatest number of Canadians as quickly as possible in this pandemic context. Now that NACI has issued its latest full statement on dose intervals for COVID-19 vaccines, it is up to health authorities in the provinces and territories to decide how best to apply it in their immunization programs. As vaccination programs continue to roll out and more scientific information becomes available, we will certainly see further updates and changes in advice and plans. I urge everyone, even after you get your vaccine, to continue to adhere to public health measures such as social distancing, wearing a mask, and washing your hands frequently. These are necessary mainstays in our commitment to preventing the spread of COVID-19 and its variants. And if you haven't done so already, please make a point of finding out when and how you can register to get your vaccine. Your local public health website should have the information you need. Thank you. Bonjour à tous et merci de vous joindre à nous.
Hello, everyone, and thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here today with Major General Danny Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada. We'll provide brief remarks and then open the floor to questions. To assist us in addressing your questions, we have with us Joël Paquette from Public Services and Procurement Canada. To date, more than 7 million doses of COVID-19 vaccines have been administered in Canada. Among those people 80 years of age or over, 81% have received their first dose and 10% have received their second. And among those 70 to 79 years of age, 53% have received their first dose and 2% have received their second. Yesterday, the National Advisory Committee on Immunization, or NACI, outlined evidence that reinforces their recommendation to extend the time between the first and second dose up to 4 months. Once all eligible populations have been offered their first doses, second doses should then be offered as soon as possible. The rationale for NACI's latest update is that extending vaccine dose intervals will optimize vaccine rollout and allow many more people to gain protection by receiving the first dose of an effective COVID-19 vaccine sooner. Although the vast majority of people in this country were unaware of NACI until a few months ago, the committee has a long history of providing trusted advice in Canada for more than 50 years. Members of the committee are experts in infectious disease medicine, public health, epidemiology, immunology, anthropology, and health economics, who provide advice on vaccines to ensure the best guidance for the Canadian population. It is important to point out that these experts volunteer their time and expertise to be part of this advisory committee. NACI and Health Canada perform important yet distinct roles. As the regulator, Health Canada authorizes vaccines based on evidence obtained from clinical trials and post-market surveillance. It does not make recommendations on how the vaccine should be used for the best possible public health impact. While NACI reviews the same clinical trial data as Health Canada, it also carefully considers all available evidence about how well the COVID-19 vaccines are working in the real world and applies a public health perspective considering the burden of illness in Canada. Beyond the vaccine characteristics, NACI also reviews mathematical modeling, assesses vaccine supply, and takes into account the programmatic realities of equity, feasibility, and acceptability. NACI is focused on the public health perspective to promote the best outcomes for the greatest number of Canadians as quickly as possible in this pandemic context. Now that NACI has issued its latest full statement on dose intervals for COVID-19 vaccines, it is up to health authorities in the provinces and territories to decide how best to apply it in their own immunization programs. As vaccination programs continue to roll out and more scientific information becomes available, we will certainly see further updates and changes in advice and plans. I urge everyone, even after you get your vaccine, to continue to adhere to public health measures such as social distancing, wearing a mask, and washing your hands frequently. These are the necessary mainstays in our commitment to preventing the spread of COVID-19 and its variants. And if you haven't done so already, please make a point of finding out when and how you can register to get your vaccine. Your local public health website should have the information you need. I will now ask Major General Fortin to provide his opening remarks. Thank you. Thank you, Dr. Njoo.
Good afternoon, everyone. To date, we have distributed approximately 10.5 million doses of vaccine to provinces and territories. Over 2 million doses of vaccines have been distributed through Easter weekend and beginning of this week. We received the first shipment from Pfizer-BioNTech for the second quarter of the year this week, totaling a little over 1 million doses, and deliveries to provinces is now complete. As mentioned, we continue to expect that a steady flow of 1 million doses of Pfizer-BioNTech coming in country on a weekly basis through April and May 2021. Quantities will increase in June. Therefore, in the next 3 months, we expect to receive over 17 million doses of Pfizer-BioNTech alone. Deliveries of 590,000 Moderna doses were completed over the past weekend. Our next shipment of 855,000 doses of Moderna are expected to arrive early next week, with onward deliveries to provinces and territories to occur by the end of the week. The following shipment is expected to be around 1.2 million doses, with the delivery into the last week of April. Exact dates of delivery are yet to be confirmed. For AstraZeneca, 1.4 million doses from the facility in the United States were delivered last Saturday to provinces. The remaining doses are being delivered this week for a total of 1.5 million. The COVAX shipment of approximately 317,000 doses of AstraZeneca arrived this morning in Canada. Distribution across the country has started already this morning and is expected to be completed by tomorrow. This is the first shipment from the COVAX facility, and we expect to receive 1.9 million doses from COVAX in this quarter. I want to take a minute to go over supply chains. The distribution of COVID-19 vaccines into and across Canada is an unprecedented operation in scope and complexity. The first step in the process remains the confirmation of the quantity of doses that have been allocated by manufacturer to Canada and an anticipated release date, assuming the doses pass all quality control steps. From this initial notification to the confirmation of all of allocations with the provinces and territories, and the ordering process, all while ensuring adherence to cold chain requirements, it can take between a total of 7 and 10 days for the vaccine to arrive in Canada and to be distributed to provinces and territories. Delivery time to provinces and territories' designated vaccine distribution site may vary depending on the location. The further from the central hub and the more isolated or rural a region is, the longer the delivery time could be. Generally, however, we're able to deliver vaccines within 2 to 5 days of them arriving in Canada, and provinces then leverage their own distribution systems to further distribute to hundreds of sites across the nation. With over 10 million doses delivered by Easter weekend, we have exceeded our initial objective in the first quarter of this year. This is possible thanks to the hard work of all our colleagues at the federal and provincial and territorial governments, but also of all the healthcare professionals throughout the country. Our distribution tempo will keep on increasing, with around 15 million cumulative doses expected by the end of the month, encompassing Pfizer, BioNTech, Moderna, and AstraZeneca vaccines. Bonjour à tous et à toutes.
Good afternoon, everyone. To date, we have distributed over 10.5 million doses of vaccines to the provinces and territories. Over 2 million vaccine doses have been distributed through Easter weekend and this week. We received the first shipment from Pfizer BioNTech for the second quarter of the year this week, totaling a little over 1 million doses. Deliveries to provinces are now complete. As mentioned, we continue to expect that a steady flow of 1 million doses of Pfizer BioNTech coming in the country on a weekly basis through April and May 2021. Quantities will increase in June. Therefore, in the next 3 months, we expect to receive over 17 million doses of Pfizer BioNTech alone. Deliveries of 590,000 Moderna doses were completed over the past weekend. Our next shipment of 855,000 Moderna doses are expected to arrive early next week, with onward deliveries to provinces and territories to occur by the end of that week. The following shipment is expected to be around 1.2 million doses, with the delivery into the last week of April. Exact dates of delivery are yet to be confirmed. For AstraZeneca, 1.4 million doses from the facility in the United States were delivered last Saturday to provinces, and the remaining doses are to be delivered this week for a total of 1.5 million doses. The COVAX shipment of approximately 317,000 of AstraZeneca doses arrived this morning in Canada. Distribution across the country started this morning and is expected to be completed tomorrow. This is the first shipment from the COVAX facility, and we expect to receive 1.9 million doses from COVAX in the second quarter. Allow me for a minute to talk to you about the supply chain. The distribution of COVID-19 vaccine into and across Canada is an unprecedented operation in scope and complexity. The first step in the process remains the confirmation of a quantity of doses that have been allocated by a manufacturer to Canada and an anticipated release date, assuming the doses pass all quality control steps. From this initial notification to the confirmation of allocations with the provinces and territories and the ordering process, all while ensuring adherence to the cold chain requirements, it can take between a total of 7 and 10 days for the vaccine to arrive in Canada and to be distributed to provinces and territories. Delivery time to provinces and territories' designated vaccine distribution sites may vary depending on the location. The further from the central hub and the more isolated or rural a region is, the longer the delivery time could be. Generally, however, we are able to deliver vaccines within 2 to 5 days of them arriving in Canada, and provinces then leverage their own distribution systems to further distribute to hundreds of sites across the nation. With over 10 million doses delivered by Easter weekend, we have exceeded our initial objective in the first quarter of this year. And this was possible thanks to the hard work of all our colleagues at the federal and provincial and territorial governments, but also of all the healthcare professionals throughout the country. Our distribution tempo will keep on increasing, with around 15 million cumulative doses expected by the end of the month. The end of the month, as I said, encompassing Pfizer, BioNTech, Moderna, and AstraZeneca vaccines. Thank you, and I'm available to answer any questions you may have.
Merci beaucoup, Major General Fortin. We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. We'll be taking questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une des deux langues officielles. Opérateur, première question. First question, please.
Thank you, merci. Please press star 1 at this time for any questions. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. And our first question, la prochaine question est de Philippe Vincent Foisy de Radio-Canada. Please go ahead. La parole est à vous.
Oui, bonjour. La question est pour Monsieur Njoo, puis peut-être Monsieur Fortin, si vous voulez réagir à tout ça. Quand vous nous avez présenté vos modélisations, il y a presque 2 semaines, vous avez dit qu'il y a une course en ce moment qui est très serrée entre les variants et les vaccins. Aujourd'hui, si vous nous faites un peu l'état de cette course-là, est-ce que les variants sont encore en avance?
If you were to describe that race today, would you say that it is still a tight race between variants and vaccines? Thank you for the question. And this is Dr. Njoo. I would say that this is a tight race between vaccines and the variants. However, it's not quite as black and white as that. Vaccines are one layer of protection, but it's very important to implement other health measures. For example, individual practices and also practices that are carried out at the population level. So it's not as simple as that when one says it's a race between variants and vaccines. We're going to continue to vaccinate as many Canadians as we can, as quickly as possible, but there are other practices that are also very important. In some provinces, COVID-19 transmission is an issue, and also the numbers of variants are increasing. So we really have to keep up all our public health measures, as well as continuing with the vaccine rollout throughout the country. Thank you. Follow-up. I have a question on AstraZeneca. I'm wondering what might have changed. In Quebec, AstraZeneca won't be sent to a BTB because there is a Brazilian variant there and the South African variant, and we're worried that it's not quite as effective. So how do you think the vaccination strategy should be reviewed, given the limitations of AstraZeneca. Perhaps there may be another vaccine available if those variants become dominant. So do you foresee having to change your strategy somewhat? Well, this is Dr. Njoo, and this is my answer. We don't necessarily have the evidence here to show that vaccines are not effective against any of these strains or variants of the virus. And so I think it's important to continue with our vaccination program. These vaccines have been proven in Canada. And as I have already said, it's equally important to continue with all our public health protection measures. It's not just an issue of vaccination. Certainly, we are keeping a close eye on what is happening with other countries, their own experiences, their vaccine rollout programs, what's happening with the variants. I also know that businesses and manufacturers are continuing to look at their own experiences. They're continuing to make sure that their vaccines are effective against the variants. So for now, that's our strategy. But I also want to underscore the fact that it's very important to continue with health protection measures, not just vaccination programs. Thank you.
Merci, Dr. Njoo. Operator, next question.
The next question, la prochaine question est de Hannah Thibodeau from CBC News. Please go ahead. Your line is open.
Hi, thank you for taking our questions. I'd like to start first. Many young Canadians who received a first dose of the AstraZeneca vaccine are now concerned about their second dose, and that this shot is really being discouraged from their age group. What is the plan for them?
Okay, it's a Dr. Njoo. I'll take that question. I'll start off. First of all, in terms of the AstraZeneca vaccine, the fact is that overall it's a very I think safe and effective vaccine. I think at the the global level, over I think close to 200 million doses of the vaccine have been administered, and I think it's been proven and shown in many countries to have a very important sort of impact in terms of preventing a serious illness and death. So I think that needs to be stated up front, and that I think it would still be the case here in Canada. I think it's a credit to sort of the surveillance systems in Europe, as well as obviously a system here in Canada, post-marketing to be able to have detected the safety signal, this rare event, with the blood clots that we all know about now. That is rare, but that certainly needs to be taken seriously and looked into. So I think in Canada, we are taking the prudent approach based on the recommendation from NACI. We're taking a pause in terms of use of the AstraZeneca vaccine for those under 55 years of age, but certainly continue to recommend very strongly, in terms of the benefits versus the risk. Anyone over the age of 55, you should accept or certainly go for the first vaccine that's offered to you, and that includes AstraZeneca. For the younger ones, I think we'll let it play out in terms of the due diligence. I know that Health Canada, as a regulator, has been in very close contact and communicating and with their European counterparts. They actually participated in a meeting of the European Medicines Agency, and so are well aware of the data and the evidence that was put forward in terms of what's happening in Europe. They've also put additional terms and conditions to AstraZeneca in terms of requesting additional data stratified by age and gender, so they can do further analyses and in the Canadian context. And so based on that, they'll do their deliberations and come forward with recommendations as appropriate. And then obviously following sort of the data coming from Health Canada, NACI as a sort of an expert advisory committee would take that into account and provide updated guidance as necessary and appropriate. I think there is a bit of time because we are NACI has recommended the dosing interval could be extended up to 4 months, and so I think for the time being, I think that folks are fine. I think that other options could be looked at. I think what you might be getting at, and we're seeing some experience and sort of trials going on around the world in terms of a mixed schedule, where someone might be receiving a first dose of a certain type of vaccine, and then their second dose is another type of vaccine. We're looking very carefully at that as well to see what the outcomes are in terms of overall effectiveness, and certainly that'll be taken into account in terms of what might be put forward here in Canada. But at the present time, you're right. The current sort of recommendation is that if you begin a series, especially a 2-dose regime for a certain vaccine, it's obviously better to continue and have your second dose with that same vaccine. But there is some time, and we're all looking at the data, and we'll make the adjustments as necessary and appropriate. Thank you.
So just to clarify, for someone who's under 55 who received their first AstraZeneca dose, it's wait for now. Hopefully you will be able to get your second AstraZeneca dose, but it could become potentially a second dose of Pfizer or a second dose of Moderna. Am I correct in what I'm saying?
It's possible, but at the present time, I would say that Health Canada is looking at the data. That they'll certainly take that into account in terms of what is best in the Canadian context, and then NACI will also look at the data as it continues to evolve and become available from other countries around the world, and they'll make the best recommendations for what we could or should be doing for, quote, as you say, that second dose for the AstraZeneca 2-dose regime.
Thank you, Dr. Njoo. Next question. Prochaine question.
Thank you. The next question. La prochaine question est de Raymond Filion de TVA. Please go ahead. La parole est à vous.
Merci et bonjour. Une question peut-être pour Mme Paquette ou le Major Général Fortin. Est-ce que vous avez
My question is for Ms. Paquette or Mr. Fortin. Do you have more information on the Johnson & Johnson vaccine shipments to Canada, a date, for example? Answer. Thank you for the question. We are still speaking with Johnson & Johnson currently. And we will be receiving information on shipments as soon as possible. Thank you.
Okay, donc pas d'information.
Follow-up. And so you have no information for now. My question is for Dr. Njoo. We're seeing a spike in cases in Canada. We're almost catching up with the States. How do you explain that shift? Because there was a huge discrepancy between the numbers in Canada and the United States, and now we see this spike in new cases. Can you explain that? Have we dropped the ball in Canada? Answer. Thank you for the question. I think it's difficult to make a general statement. You know, regions and provinces and territories throughout Canada have their own context. Generally speaking, though, the situation in the territories as well as the provinces and the Atlantic provinces isn't bad. There aren't too many outbreaks. However, when you look at the 6 provinces to the west of the Maritimes, and for example, British Columbia, and provinces, the Prairie provinces, Quebec and Ontario, yes, the situation is concerning. This is something we need to follow closely. There are unique factors in every province and territory, and I think there are 3 very important factors. First, we need to continue public health protection measures. We mustn't relax those measures. And we can see what is happening in Ontario and in Quebec. Second, I would say that there is individual responsibility on the part of every Canadian to restrict their contacts, to stay at home, not to engage in any leisure travel, to continue to practice all those good individual health protection measures, for example, wearing a mask, distancing, washing your hands. And if you are offered a vaccine, then it's very important to accept that vaccine, regardless of the one that's being offered. And if we can ensure that those three factors are being respected, then we'll be able to control transmission here in Canada. We don't really necessarily need to compare ourselves to another country. We need to do what needs to be done here in Canada. Thank you.
The next question, la prochaine question est de Mackenzie Gray from CTV. Please go ahead. Your line is open.
Hi there. My first question is for Dr. Njoo. Dr. Njoo, correct me if I'm wrong. From previous press conferences, you and Dr. Tam have been saying throughout this time that it makes the most sense for provinces to vaccinate people moving down by age, because those are the people who have the highest risk of dying if they contract COVID-19. There's been a lot of people who've been pushing recently to have essential workers, teachers, people who work in factories vaccinated, potentially ahead of some of those people who are older. Do you think that is a good strategy to change now, considering variants seem to be impacting younger people more?
Yeah, well, first of all, thank you very much for the question, Mackenzie. I wouldn't say that it's any change in the strategy. Right from the get-go, when NACI came out with their recommendations, I think everyone was agreed that the highest risk group were certainly older Canadians, especially those over 80 years of age. And we certainly saw what happened, for example, in long-term care facilities in terms of serious consequences and as well as death for those older individuals. And in the first quarter, with a relative scarcity of supply of vaccines, 6 million doses we anticipated. We actually did better than that. I think, over 10 million doses now received in the country. That made sense to prioritize older Canadians. But if you look at the NACI guidance, there is a listing of all of the priority populations. And as more and more vaccines become available, obviously you look at all of the groups, and then I guess I would defer to the provinces and territories based on their demographics, their local context in terms of vaccine supply, where the outbreaks are occurring, et cetera, and so on. They would be in the best position in terms of how they roll out their vaccination programs. So, for example, I know in Ontario, they're looking at hotspots and younger folks, the issue of essential workers. That's actually listed in the NACI guidance in terms of being a priority population. Where it is in the sequence, I think certainly was more important in the first few months of this year. But as more and more vaccine doses become available, millions of doses are coming in sort of on a weekly basis, then I think it becomes less and less of sort of an issue as, in essence, all Canadians will, essentially be offered a vaccination at some point. And so I think I would leave it to the provinces and territories in terms of how best to, at the present time, but moving forward, to administer the vaccine doses they receive to their own populations. Thank you.
My follow-up question is for Major General. Yeah, and my follow-up question is for Major General Fortin. President Biden in the U.S. has come out and said on April 19th, all Americans will be able to be eligible to be vaccinated. You know the numbers better than anybody in terms of the vaccines coming into Canada. Can you give us maybe a week or a more specific time frame as to when you would expect we have enough vaccines in Canada to vaccinate all eligible adults?
Yeah, thank you for the question. I think the projections that we have shared to date are very positive, and it would lead one to believe that if those deliveries occur as planned, without any delay or significant delay, provinces and territories will be in a position to vaccinate all Canadians that are we're expecting to vaccinate the adult population in time for summer to early fall. I think it depends on a number of factors, but certainly if provinces and territories adhere to a 4-month interval, and the flow of vaccines, as I indicated, is positive or remains the same. The demand for vaccines from Canadians remains high, then I can't see why we wouldn't be able to accelerate that. But I'd be speculating about a specific date.
Thank you, Major General Fortin. Operator, next question. Prochaine question.
Thank you. The next question. La prochaine question est de Hélène Buzetti des Corps d'information.
Question from Hélène Buzetti. Good afternoon. I'd like to follow up on the question that was posed by my colleague Raymond Filion on the Johnson & Johnson vaccine. You said you're still in discussions, but can you tell me what's taking so much time? It's been more than a month since that vaccine was approved in Canada. So what isn't working out? Answer. It's not that something isn't working. We will have deliveries arriving here in Canada. We're simply working on that timeline with the company. Thank you. Follow up then. You say that the shipments will arrive by the end of April, but I'd like to ask the same question about AstraZeneca. We've been receiving doses from the United States, from the COVAX facility. What about the 20 million that were promised for the second and third quarters? How come we do not have a time frame for the shipments? Thank you. Answer. Thank you. We expect shipments by the end of April from Johnson & Johnson, yes. And we will be providing more information once we have that information in hand. In terms of AstraZeneca, as you say, we've received our doses from the United States. That 1.5 million is part of the 20 million under their agreement with us. And as Minister Anand announced, we expect to receive another million in June, and we're currently working on the shipment calendar for that month of June. Thank you.
Merci beaucoup. Opérateur, prochaine question. Next question.
Thank you. The next question. La prochaine question est de Tonda McCharles from the Toronto Star. Please go ahead. Your line is open.
Hi. Good morning. Last week, Major General Fortin, you talked about AstraZeneca's take-up and that a certain portion of the first 500,000 had been administered. Can you give us an update on the AstraZeneca take-up in Canada and how the recommendation to suspend for those under 55 has changed the timing of your expectations that when the Canadian population would be covered?
Hi, it's General Fortin here. Can you hear me?
Yes, we can.
Sorry, so I missed part of the question. I had some technical challenges, as you can see here. So I heard part of your question. I'm sorry, Tondra. Could you repeat that?
Yeah, sure. So my first part was last week you told us about a certain portion, the majority of the AstraZeneca vaccines that have been distributed to provinces had been administered. And so a week in now, I'd just like to understand what the latest numbers are on that, on the AstraZeneca uptake, and how the recommendation to suspend it for below 55 years has changed your expectations for the timing of the coverage plans.
Yeah.
Does that make sense?
Yes, Tondra, thank you for the question. We have, at this point, we have just about 480,000 doses administered of AstraZeneca that came from the Covishield allocation a few weeks back. And those remaining are all, or still have, or we're still within the expiration date. So they don't expire for several weeks. Of the new allocation of 1.5 million, the distribution is still underway. We'll finish this week. But the vast majority were distributed, as you pointed out. 1.4 million out of 1.5 were distributed last Thursday, just prior to weekend starting. So so what I would suspect is the provinces are adjusting their plans, and they are delivering those in through different modalities. I know of provinces, for instance, that are leveraging their pharmacies more than others, specifically about AstraZeneca. So that's still unfolding. It's a little early to judge right now. Whether or not we're immunizing fast enough, or if there are any hiccups with the administration of those vaccines. A small quantity, I think about 6,000 of the 1.5 million have been administered to date. So I anticipate that to pick up quite rapidly over the next several days and week. I think from my viewpoint, unable to assess whether or not the decision to move to 55 has dramatically changed anything. I think it's a little premature to judge that right now, so time will tell, and once we know that, we'll return. But I think my colleague Dr. Njoo might have a little bit more to add on that.
It's Dr. Njoo. Not really much more to add. Certainly, just anecdotally, I think there's been good uptake. Certainly here in Ottawa, I understand there's waiting lines at pharmacies and sort of all of the sort of the outlets in which the vaccines are being offered, and people are taking it up. I think people are taking the message to heart that it's important to get vaccinated as soon as possible when you get offered one of the approved vaccines here in Canada, including AstraZeneca. So I think it's looking good, and I hopefully as more and more Canadians become vaccinated, then we'll reach our objective of all Canadians being vaccinated with the 1 and 2 doses. I think the Prime Minister spoke to it as sort of towards the end of the summer. So I think we're on track for that, and I think we just need to keep, as they say, our nose to the grindstone and keep focused on the task at hand.
Thank you, Dr. Njoo. Tonda, follow up.
My other question, Dr. Njoo, is you mentioned several times in this news conference that people who get vaccinated have to continue with all of the individual public health measures and respect the population level public health measures. So I'd like to know at what point you intend to issue specific guidelines or advice for vaccinated people and what they will or won't be permitted to do, such as we've seen in the CDC. I know you've been asked this question a number of times, but now we're well into it. So I wonder if you have any advice for us right now, since people are getting those vaccines in their arms.
Okay. Do you have half an hour or so? No, I'm kidding. But
yeah, I'll take it.
I'll be honest. Sure. It is.
Still your business.
No, it is a complex issue, and I would say that. First of all, there's a lot of aspects in terms of just how effective the vaccine is and so on. So I'll hit a couple of points. First of all, in Canada, we're doing sort of one dose to everyone to give them a certain high level of protection, and then we're going to aim for the second dose. So I think most people would understand that certainly with the one dose, it gives you a good level of protection. But I think, in Canada, I think we have more of I would call it a sort of a community or collective sort of approach to vaccination. So by having the one dose, you give yourself a certain level of protection, but you're also, in many ways, helping to protect not just yourself, but your family, your friends, but also even, let's say, people you don't know in your local community, because it also helps to diminish or decrease what I call local or community transmission. So that's an important point to make. Once you get 2 doses, you will have the maximal protection that you would get from the vaccine. But even then, here's the interesting point. Let's say, just for the sake of a number, a vaccine, and we know no vaccine is 100% effective. So let's say you have a vaccine, 2 doses, you have a 90% effectiveness. I think on an individual level, that's great. You can go around, wow, I protected, 90% protection. That's great. But if you look at a population level, think about it. That means that you have 100 people vaccinated. For every 100 people vaccinated, 90 actually will have the protection of the vaccine. But unfortunately, there would be 10 people that, even though they're vaccinated and thinking that they're protected, actually the vaccine wouldn't work for them, and they would still be susceptible to, getting COVID-19, and then, if they got it, getting sick and transmitting to others. So that's the reason why we still talk about the fact that, hey, even if you get vaccinated 1 or 2 doses, it's not sort of free for all in terms of you can do what you want, because there's still that possibility that you aren't protected individually at a population level, and you could transmit it or get infected yourself. So that's one point. The other part also is that even in terms of the vaccine itself, the other characteristics we're still learning about. The vaccines have proven to be effective in terms of real world evidence with respect to decreasing the risk of severe illness and death. But in terms of asymptomatic infection transmissibility, that's still, I think, a bit of an open question. There's some good evidence from around the world that, hey, it's pretty good in terms of preventing onward transmission, but it's not, I think, 100%. So that's another, a question that still, I think, the science is out there to look at. And then I think another aspect is obviously the durability of protection, right? Hey, these vaccines have only been around, since sort of late last year, and here we are into the first quarter, past the first quarter, here into now April in Canada. And so here in Canada, but also around the world, we're still learning as we go in terms of how well they're working in terms of effectiveness and in terms of also durability of protection. So that's another aspect. And of course, with the variants, we're still keeping an eye on in terms of the vaccine effectiveness, looking at to see if there are what we call vaccine escape situations or cases as we move along with our vaccination. So with all of these factors in play, I don't think it's as straightforward in terms of giving guidance to people. Yes, you can do this or you cannot do that based on getting 1 or 2 doses of the vaccine. The other part also I would say is that to finish off the answer for now is that it also depends on local context and epidemiology, because depending on the sort of the circulation of the virus in your local community, even with 1 or 2 doses and all the things I just mentioned, just now, that will also determine what local authorities feel comfortable in terms of, allowing certain types of activities, mass gatherings and so on. So I would say, just for the sake of an example, who knows now or maybe a few months down the road, if you've received 2 doses in Charlottetown, PEI, the situation based on the epidemiology, you may be allowed to do more things in that environment and situation compared to, let's say, having received 2 doses in downtown Toronto. So that just gives you a simple example that it's not straightforward, and you can't have a one-size-fits-all approach in terms of guidance in terms of what Canadians can or cannot do having received 1 or 2 doses of the vaccine. Hopefully that answers part of your question, at least.
Thank you, Dr. Njoo. Operator, prochaine question, next question.
Thank you. The next question, la prochaine question est de Mia Rabson from the Canadian Press. Please go ahead. Your line is open.
Hi. I'm wondering if you can update us on whether or not you had any reports of blood clots in Canada from AstraZeneca or any of the other vaccines, and if you have any kind of expanded monitoring of people who have got the AstraZeneca vaccine to try and catch any of these cases.
It's Dr. Njoo, so I can take that question. As I mentioned, I think at the beginning or even at previous press conferences, I think Canadians should be, sort of at ease or comfortable with the fact we have a very robust, what we call post-marketing surveillance system here in Canada, in which, there's 2 parts of it in terms of the manufacturers are also required to report to Health Canada any reports they have or information with respect to adverse events, and then through, quote, the public health system of reporting that the Public Health Agency of Canada has sort of in place with the provinces and territories. We also receive reports. I think to date, there's been a little over, 3,000 events reported to us. And as I've mentioned before, these events are any event that happens, quote, following vaccination, but not necessarily because it's any sort of causal association. We know that there's a lot of what we call background rates for all sorts of health events that would have happened anyway. And just because we're now vaccinating millions of Canadians, it's to be expected that some of these events might happen temporarily, as we say, after vaccination, but not as a result of the vaccine administration itself. But obviously we take every event seriously. There's certainly, based on criteria, investigations and so forth to look at it. I think there's been about 400 or so serious events like severe allergic reactions that have been looked into. But to get to sort of the final answer for you, in terms of the rare sort of thromboembolic event that's been reported in Europe, here in Canada to date, no, we have not had any of those events reported officially to us at the national level. Of course, there are other types of what I would call thrombotic events. And so maybe that's something that might not be clear. Other simple blood clots in the legs and so on that happen maybe, as I said, either just in terms of a background rate or maybe temporarily after vaccines. Those are also looked into and investigated, but certainly no safety signals, I'd say, overall have been reported to date to us here at the national level.
Thank you. Follow-up, Mia?
Yeah, and I just have a couple of questions about the numbers and on the slides and information you handed out today. So on the one slide, it looks like we're expecting about 5.3 million doses in April, which seems to be less than we got in March. And I'm just wondering if you can confirm that that's true and what impact that getting less in April may actually have. And also, Moderna's doses, my understanding, they were supposed to arrive this week, and now you're saying they're going to arrive next week. So is there another delay on getting Moderna's doses because of the quality assurance program or other reasons?
Yeah, so we have 1 million a week of Pfizer. There are 4 weeks in April as opposed to 5 weeks of March, where we had just about the same per week. So 4 weeks, so 4 million right there. We expect to receive 855 plus the 300 we just received this morning of COVAX, AstraZeneca. So that's 5. And we're slightly above another million by the end of the month, at the end of the month. So I'm cautiously optimistic. So you can do the math. You can see that it might bust at 5.3 million slightly. But I think it's prudent to leave it where it is for now, and we'll continue to update as we move forward. So that's the first part of the answer. Secondly, I think when it comes to Moderna, we've been indicating for a while that Moderna was able to move from a 3-week cycle to a 2-week cycle. And with an expected delivery to Canada or expected pickup in Europe with our logistics service provider in that said week. Recently, they experienced some backlog with quality assurance. It's part of their manufacturing process. At the tail end of the manufacturing process, they want to, as you would suspect, they want to go through the proper quality assurance processes, and there's a backlog. And as a result, we expect to pick up doses that were scheduled for this week, early in the week, so possibly Monday, with arrival here the next day and distribution right away to provinces and territories. So to be completed by Friday the 16th. The same deal happens, or we anticipate the same deal for the 3rd week of April, where it might be available for pickup at the end of the week or early in the following week. And therefore, I think it's prudent planning on our part right now to bank on the last week of April, and we'll advise as we get closer or as we get through it. So that's the best I can tell you for now with regards to Moderna backlog with the quality assurance processes. We don't anticipate that to last beyond that month, but according to AstraZeneca, but we'll advise as we get more from them moving forward.
Thank you, Major General Fortin. Operator, next question. Prochaine question.
Thank you. The next question, la prochaine question est de Ryan Tumulty from the National Post. Please go ahead. Your line is open.
Yeah, good afternoon. I've noticed in the stats that you've provided that the Northwest Territories, the Yukon, and Nunavut are well ahead in their vaccination efforts. I know that was a deliberate effort, a deliberate decision made early in the process to send them more vaccines than they would have otherwise qualified on a per capita basis. I'm wondering if you can talk me through why that decision was made, what was the reasoning for that decision, And I'm also wondering if you're following how their rollout is going because they're much further along than the rest of the country.
Okay, well, I'm happy to explain that. I explained that several times earlier in the winter. And you'll recall we discussed at the time that we're into an unprecedented activity distributing vaccines across the nation with the population density that we have in winter in remote locations, and in particular, there are additional variables at play in the territories, variables that they have to contend with that others don't have. Case in point is the vaccinators and some of the support staff, but the vaccinators in particular often come from provinces and are currently in the territories on an extended period for the purpose of administering those vaccines, in addition to the small medical staff that they have already. The second important point is remote and indigenous and isolated locations throughout the country, territories included, have challenges with access to healthcare that make it even harder for those populations to get access in a timely manner, given the volume that of people that could potentially get COVID. So the decision was made, and I think Dr. Njoo could expand on that with greater fidelity, but decision was made through various tables to recommend an approach where 75% of the adult population in the north would have access to vaccines in the first quarter. And that's a commitment that the government went with, and we provided those doses to the territories to administer, and they are progressing very well. When you look at all the variables at play, there's a combination of different modalities, super site in Whitehorse, community hopping with small teams to various locations throughout the territories, even more so in Nunavut, given the litany of distances there. So I don't know if Dr. Njoo has anything to add to this, but that's part of the reason why they saw an accelerated delivery, and they are progressing very well. We're monitoring very closely with them as well, their progress and their assessment of the demand. If there's anything that we can do and we can replicate or adjust with the provinces to ensure that we take on board all the best practices and lessons that we identify from across the country, including, of course, the territories in this case.
Yeah, Dr. Njoo, I really don't have much to add to Major General Fortin's excellent answer. I think maybe just a simple anecdote to sort of get all of the issues he's raised. Obviously, the isolation, the unique vulnerabilities, the limited access to healthcare services. So from a practical point of view, if you've got a remote community and you're doing strictly based on the criteria, for example, we talked about earlier in this press conferences and also previously, let's say based on age. And so, we say, okay, it's only, individuals 80 years of age and older. So you go to a small isolated community, and there's a household that has the 80-year-old grandmother, but you have several other members who are also younger in the same household. If one of them were to get infected, it would be much more easily passed on to the others. And then, of course, you get the issue of access to healthcare, and you have a plane coming in to vaccinate, and it's difficult enough, in the winter to get to this isolated community to vaccinate, quote, the 80-year-old grandmother. So why not? It just makes a whole bunch of sense for different, a whole bunch of reasons to vaccinate all of that household and all the members of that community rather than just going strictly by sort of, various criteria such as age at the beginning. So I think that was the thinking. And certainly I think the territories have done an excellent job in terms of vaccinating their populations. I think a few weeks back, we mentioned, what percentage of the populations in the territories have been vaccinated. And, I don't have the updated figures with me, but certainly I think we can make that available to show you how well they're doing. Thank you.
Thank you, Dr. Njoo. Follow up, Brian?
Yeah, I appreciate all of that answer. I'm just wondering, they've been able to lower restrictions there. because of, partially because they took a zero COVID approach, and also because of this widespread vaccination effort. I'm wondering if, we've talked a few times here about being uncertain when we'll be able to reach herd immunity. I'm wondering if the territories potentially give you an opportunity to see a real world example of that and know when a community might be fully protected at what sort of vaccination level.
Yeah, it's Dr. Njoo. I think that's an excellent question. I think we're all learning, both here in Canada and around the world. And you're right. As populations get vaccinated, and you look at the level of circulating virus, herd immunity, vaccine coverage, all of those parameters are very important to study. And I think as people are getting vaccinated, obviously, there's record keeping involved in terms of, collecting the data. And certainly what we're looking forward to is hopefully, as you say, the sharing of the data, even publications in terms of how various situations, be the outbreaks, are managed. There's lots to learn. And so you're right. It's sort of a good news story. What's happening in the territories with their, I think, overall low level of COVID-19. I think the success of their vaccination programs, but it's, as I said earlier, it's not just the vaccination alone. It's some of the other sort of a good implementation of public health measures, both at an individual level and also, I think, at a population level that have contributed to that. And if there are lessons to be taken from that could be applied to other contexts in Canada, certainly among the provinces and territories, we're always exchanging best practices at our special advisory committee. Some things, obviously, I think might be transferable or sort of applied, more generally from jurisdiction to jurisdictions. Others, I think, to be quite honest, I think are unique to the context of the territory. So, what might work in Whitehorse might not necessarily apply to, let's say, again, using the example of downtown Toronto with its greater population density, et cetera. So I think there's still lots we can learn and should learn. And I think as we go on, I think the goal of vaccinating all Canadians as soon as possible, who are eligible, I think is what we're all still focused on.
Thank you, Dr. Njoo. We have time for one last question. Dernière question, s'il vous plaît, opérateur.
The next question, la prochaine question est de David Aiken from Global News. Please go ahead. Your line is open.
Thanks very much, guys. Question for Major Fortin. There's a lot of back and forth in various provincial jurisdictions that, provinces have so many doses in the freezer. If I look back sort of historically over total doses received by Canada, and compare that to total vaccines distributed, on any given day, there's between 20 and 25% in a freezer. In other words, it seems provinces are keeping a buffer, and that's since the beginning of January. So I wonder if you could just explain, is that normal that there would be essentially a buffer that provinces would manage? And then the corollaries of in the last couple of weeks, that buffer has increased a little bit, and on Monday it peaked at 35%. 35% of total vaccines distributed were still in freezers, and we haven't been at that ratio since January. So could you speak, Major Fortin, I know it's going to vary locally, but just generally about the concept of we're never going to have 100% of all the vaccines distributed in arms. There's always going to be some in a freezer. Does that make sense?
It does. Thank you. That's a great question. So let me expand on that a little bit. I think provinces and territories do their very best to administer as rapidly and as effectively as possible vaccines to Canadians throughout the country. Full stop. Now, no one is holding on to vaccines in reserve in case of, except for local readjustments. What I would say is, and based on a lot of conversations at all levels that are we maintain conversations, through the week, every week with provinces and territories. What we see is a real desire to ensure that they have a constant flow of vaccines to some of the rural and remote locations in their jurisdiction. And I know of a number of anecdotes where, because of delays in supplies or challenges with weather and so on and so forth, they had to shift doses from one community to another, only to shift right back the next day once they have received the vaccines they were supposed to receive. So there's a constant, vaccines are in constant movement across the country. And I tried to lay this out a little bit in my statement, where it takes days to distribute all the way to some of the most remote locations. There's also deliberate plans to deliver late to some locations, as you need to line up the right resources to include the vaccinators. And in the cases of going from community to community, particularly in Northern Ontario or north of prairie provinces, you need to time this right. So that is also in play. We are working collaboratively very tightly with provinces and territories. Just in the last week plus alone, we distributed over 100 freezers in addition to what was already distributed. We distribute them as rapidly as they are produced and brought or delivered to us. So they are brought to the provinces and territories, and that gives them a range of options to expand even more their network. On Mondays, we have a very regular delivery schedule with Pfizer. And on Mondays, you will see a spike in numbers because the majority of that million that arrives every week gets, well, at least half of it gets, with the rest delivered on Tuesday and Wednesday. So it would be unfair to look at a particular point in time. We need to even it out and look at a longer range, and you see low points and averages throughout the jurisdiction to have a better sense of how they're doing. So I would close with this. We do everything we can, close coordination with provinces and territories, to ensure that we support them the best way we can, and they are doing their best and their very best to deliver through all the various locations in their jurisdiction. That last mile, all the way to the point where Canadians get immunized, is different from one jurisdiction to another, and they're doing a fantastic work immunizing as effectively as possible given all the circumstances.
Terrific. Thank you very much. And just quickly, a question for Dr. Njoo, and I'm going to move away from vaccines for a second and to, I guess, some of the therapeutics that we need to treat seriously ill patients in ICUs. We've heard some hospitals say, Dr. Njoo, that one of the vital drugs that's in short supply is a drug called, and I'm going to butcher the pronunciation, I'm sure here, Tosilozumab. I hope that's kind of close to it. I just wonder if you're able to speak to whether Health Canada is doing more to acquire that Tosilozumab and or other therapeutics needed to treat some seriously ill patients in ICUs.
Yes, I think that the short answer to your question is yes. You know, certainly we're always looking at therapeutics as well. Vaccines are obviously, I think, a mainstay in terms of preventing illness in the first place. But for those who do fall ill with COVID-19, certainly therapeutics will be important. The mainstay really, and I think it's still in plentiful supply and is sort of, I think, sort of the main workhorse in terms of use in the therapeutic sense is dexamethasone, the steroid. But you're right, some of these other drugs are maybe in short supply. And certainly I would say that with all the parties involved, Health Canada, the Public Health Agency, looking at the clinical experts, we're looking at the ways to address that situation. Thank you.
Thank you very much. That will conclude today's technical briefing. C'est ce qui m'a fait mon briefing technique d'aujourd'hui. Passez une belle journée. Have a good day. Thank you.